Achilles Tendinopathy from Alyssa.
So like you said, my name is Alyssa Walker, and this case study explored the effects of Astym on chronic Achilles tendinopathy. So Astym is a non-invasive regenerative therapy that can promote the reabsorption of unwanted scar tissue and stimulate the repair of damaged soft tissues. The instrument used in this approach is applied topically and designed to transmit pressure to the damaged tissue to stimulate the repair. This applied force induces a cellular response that has been shown to activate scar tissue reabsorption and stimulating the overall improvement of the soft tissue. Chronic tendinopathy is the breakdown of collagen within the tendon that often leads to an infiltration of vascularity. And so tendinopathy is a condition that often results as from chronic tendinitis, which tendinitis is the inflammation of a tendon or muscle tendon attachment, typically from repetitive stress or strain. And so when there's an infiltration of vascularity within the tendon, the overall structure of the tendon is altered, which the capillary growth then weakens the tendon. So to discuss a little bit more about, I'm sorry, okay. There we go, okay. So this is the form of Astym that we used in our treatment modality, and it's just an example of how the technique was used to apply the pressure to the damaged Achilles tendon in our experiment.
What are you talking about?
There was not supposed to be sound, I apologize. So to discuss a little bit more about, to examine a little bit more about the structural changes within the tendon, I thought it would help to explain a little bit about the anatomy of a tendon. A tendon is a tough band of fibrous tissue that connects muscle to bone. Tendons are responsible for transmitting the force created by muscle onto skeletal bones, which thereby enables the movement of the skeletal bones. In general, tendons are relatively inelastic and passive structures, which are responsible for absorbing large amounts of tension. The primary component of tendons is collagen, which is bound into these tightly organized fibrils. So collagen, these tightly organized fibrils are then organized into fascicles, which then aggregate to form the overall tendon fiber, which is the basic unit. Endotendon wraps each of these fibers and binds them together, and also allows for the smooth gliding during movement of a tendon. So this rendition of the Achilles tendon is actually very cool because you can see here on the left side, this is what a normal healthy tendon should look like. You have this white shiny appearance that's given off by the tightly bound collagen, and then you have low vascularity and high organization in the tendon fibrils. And then on the right side, you can see that the collagen fibrils are disorganized, and there's an infiltration of vascularity, which you don't want in a tendon. And also the overall appearance of the white is kind of diminished to a grayish or bluish color. This is an ultrasound image of what an Achilles tendon should look like. So you can see the calcaneum right here, and then this right here is the Achilles tendon. Underneath is a fat pad, and above it is the subcutaneous. So you can see that the collagen produces these very white echogenic structures. Echogenicity refers to the ability of a structure to bounce back the initial high frequency sound wave produced by the probe of the ultrasound. So you can see that these tightly bound fibrils almost look like a river of fibers because they run very parallel and organized. This picture is what tendinitis looks like. So you can see the majority of the inflammation is on the superficial border of the tendon, and rather than in the tendon itself, but this inflammation is affecting the overall shape of the tendon, which makes it easy to see why chronic tendinitis can often lead to tendinopathy. This is an ultrasound image of what tendinopathy should look like. So you can see there's large holes of poor echogenicity. The fibers aren't very well aligned, and the inflammation within the tendon is causing an overall bowed structure of the tendon. This next image is a Doppler image. So a Doppler ultrasound is a test that uses high-frequency sound waves to measure the amount of blood flow. Vascular flow studies can detect the abnormal amount of blood flow within a vessel. So the Doppler ultrasound kind of makes it easier to visualize these areas of vascularity that shouldn't be there in a healthy tendon. This picture is from a surgical perspective of a tendinopathic tendon. And so you can see, although the incision does affect the ability to see the fiber orientation a little bit, you can still see that the fibers are not running very parallel. The overall white shiny condition is diminished, and there's like a swelling and kind of overall bowed shape to the tendon. So one of the tools I used to evaluate the condition of the tendon in the subjects was the GE Logic E ultrasound imaging unit. So ultrasound imaging or sonography, as mentioned earlier, is where it uses high-frequency sound waves and measures either the reflection or transmission of structures to produce an image. It is a safe, painless, non-invasive procedure that involves the use of a small transducer or probe and ultrasound gel placed topically on the skin. High-frequency sound waves are transmitted through the probe and the gel into the body. The transducer collects the sounds that bounce back, and the computer then uses those sound waves to create an image. Ultrasound imaging is now used widely for the assessment of tendon and ligament injuries because it allows for the dynamic visualization of the tendons and ligaments under a number of different angles. And you're getting the results back in real time, so you're able to look at these structures from a number of different perspectives. And as stated previously, it is fairly easy to detect the changes in the collagen structure because there are key identifiers like the lack of echogenicity and the lack of parallel structures. The BioPAC surface EMG unit or electromyography unit allowed us to monitor the electrical activity within the body. The body's electrical signals are detected with transducers and electrodes. These signals are then sent to the BioPAC unit through a cable or electrode lead. The electrical signals can be very minute, so the unit amplifies those signals, filters out unwanted electrical noise or interfering signals, and converts the data to a set of numbers that the computer can plot in waveforms. For this study, the gastrocnemius was used to monitor the electrical activity to monitor the overall functionality of the Achilles because the gastrocnemius and the soleus wrap around each other to form the Achilles tendon. So if you have a limited range of motion in the Achilles tendon, that will then affect the overall muscular output of the gastrocnemius. The gastrocnemius also allowed it was very superficial to the skin, so easy landmarks were accessed, like the epicondyles, fibular heads, medial and lateral gastroc head, and then the two malleoli on the ankle were used for the grounds. The rationale for the study. So Achilles tendinopathy is a condition that affects many individuals. One PubMed article said that around 52% of former runners develop chronic tendinopathy at some point in their lifetime. So it's relatively common, and since it affects the overall structural composition of the tendon, it requires a relatively long treatment period and rehabilitation period. So what we did was we used the ultrasound imaging, the BioPAC SEMG, along with goniometric range of measurements and a functional outcome scale to kind of monitor the structural changes, monitor and identify the structural changes within the tendon. My alternative hypothesis was that the use of Astym as a treatment modality in the study will result in improved movement, decreased pain, greater muscle output, and an overall decrease in the pathological condition of the Achilles. And my null was the use of Astym would cause no significant differences within the tendon. So for this project, the subject number 1, which is the experimental subject, was picked based on his tendinopathic condition, and then he was paired with another individual based on age, weight, and gender. So both of the subjects were relatively active males in their 40s. Both subjects were asked to complete a lower extremity functional scale as well as a past medical history to kind of confirm or deny their tendinopathic conditions. And then an ultrasound image was taken of both individuals, and a BioPAC SCMG was taken to kind of gather data on what their pain and overall functionality was prior to the 8-week treatment period. During the treatment period, the 2 subjects were required to come into the clinic twice a week to receive Astym treatment. This treatment consisted of 5 sets of 10 repetitions of the Astym instrument being stroked upwards from the distal calcaneal insertion upward to the proximal end of the Achilles. And 24 hours was the time allotted between treatments. And after the 8 weeks, the same lower extremity functional scale, goniometric measurements, ultrasound images, and BioPAC SCMG were taken to then compare the pathological condition prior to the treatment with the condition after the treatment. So although the control subject did not improve in his range of motion, both subjects actually improved in their lower extremity functional scale measurements. Subject 1, which was the experimental individual, improved from 61 to 75, while subject 2, the control, improved from 71 to 80. In addition, subject number 1 improved in range of motion 2 degrees from 10 degrees to 12 degrees of dorsiflexion. The control subject remained at 10 degrees both before and after the treatment. So this is an ultrasound image of subject number 1, which was the experimental individual before treatment, and you can see this kind of hole of poor echogenicity here, and the fiber alignment isn't very parallel. This is bowed out, and so after the treatment, this section right here had much greater echogenicity than before. The fibers were better aligned, and the overall bowing decreased. So here's kind of a side-by-side to compare that change before and after treatment. And then the control individual, as you can see, had a very healthy tendon prior to treatment. The fibrils all run very parallel to each other. It's high echogenicity throughout, and the band consistency is the same in both before and after the treatment. This is the P2P value for subject number 1, which is the experimental. So the P2P, or peak to peak, function from BioPAC finds the minimum value and subtracts it from the maximum value. So the greater overall size of the muscle contraction leads us to believe that there's a greater functionality of the muscles, because more muscle fibers are being recruited. So this large change right here, so both during the BioPAC tests, both subjects were asked to lay down to get a control of when the muscle wasn't contracting, and then a standing, and then they were asked to perform 3 3-second calf raises. And so the averages of the calf raise increased by a value of 0.95 with a standard deviation of 0.37. This is the max value. This is the mean value subtracted from the max value, which again is kind of measuring how great like the size of the contraction is, and again it shows a significant increase before and after treatment, which is demonstrated, or which is a sign of the greater electrical activity produced by the action potentials of the gastrocnemius. Shown here is the P-P for the control individual, and I was not actually expecting the control to improve so significantly in his overall functionality since he did have a healthy tendon before, but both the P and the mean value subtracted by the max value indicate that he did have an increase in overall functionality, which led us to believe that the stimulation through Astym can be beneficial even to a healthy tendon, since it stimulates the release of growth factors and overall like cellularity to just improve the overall pathological condition of the tendon. In conclusion, the data provided by the usage of SEMG, goniometric range of motion measurements, and ultrasound imaging in the lower extremity functional scale demonstrate the effectiveness of Astym as a rehabilitation method for chronic Achilles tendinopathy. The experimental subject had a greater range of motion, less pain, and a greater overall functional output of the muscle. Additionally, the control subject improved in overall functional output after receiving the treatment for 8 weeks. For future research, I would have really liked to have seen how this looks like on a larger scale with a larger subject group, so I can determine whether this was a statistical anomaly or whether this is this holds true for all Astym research. This wasn't also. I wanted to compare how the rehabilitation of a middle-aged male individual compares to that of a young athlete, and also how gender plays a role in the rehabilitation process, how the cellular signaling is different, just the different molecules involved. Also with the biopack, I did run into some troubles with consistency, so I would be almost done with recording a measurement and the whole last calf raise would just not appear, so we had to retake the whole thing. So I would have liked to use more consistent instruments in the data collection process. I wouldn't have been able to accomplish this research without the wonderful Spring Arbor University staff, including Dr. Ziegler and Dr. Baratovich, who had to left, and Dr. Beth Ulrich. Also, the medical systems that were used from Biopack, Performance Dynamics, and GE Medical Systems, and also the papers that provided me with reference for just background on Astym and Achilles knowledge. Does anyone have any questions?
Yeah, you put up the two ultrasound pictures, and the one I was thinking would be really interesting to see, in addition, would be the one showing one with impairment at the start and what it looks like in 8 weeks when left alone to heal.
That would also be that would have been beneficial.
And I imagine you've
seen
that.
Yes. So this individual, when he first came in, was actually impaired to the point where he was not really participating in physical activity. He was so limited. And so after the treatment, he confided that he was able to restart physical activity. He was playing soccer again. He was just overall functioning better. But I agree. I would have liked to see how that played out over 8 weeks without Astym treatment.
So just an additional control group, that's what you're suggesting?
Right,
Yeah.
right. What does it do when it's just left to heal on its own over 8 weeks' time?
Is that standard treatment?
Also for chronic Achilles tendinopathy, so the chronic, this individual has been suffering over a significant period of time. So he has tried other therapies, he's tried other techniques, and he has had it for a significant period of time. So it would be kind of safe to conclude that that's what it would look like, if not worse.
In terms of frequency, and I love the measures that come from this lab, but the condition itself, again, you did one case study, beautiful job presentation. How easy is it to increase your sample size? like in terms of the condition presentation?
So, since the sample size was taken from residents in Spring Arbor University, and actually both subjects were Spring Arbor University faculty, it was hard to find a large number of available subjects with the same chronic tendinopathy, since Spring Arbor University is a small campus.
Sure.
But also, coming in several times a week was very hard because I am a student athlete, and so
I just
having.
mean in the standard
Yeah.
clinic environment.
Yeah, it's hard. I mean, if we're working out of the U of M, we have a lot more opportunities. We are a smaller facility, and so we just didn't have that opportunity. We didn't have enough subjects to make it a larger scale study. We did have about 6 subjects total that we were considering doing, but this one, I think, had the best results. So that's why we decided to go ahead and move forward with this case study. But, yeah, I mean, the goal would be, boy, if we could get, at least 30, that would be awesome. But,
I
yeah.
just was curious how common
Yeah.
the condition was, that kind of
Oh.
background piece in terms of getting that sample, if it's too rare.
It's fairly common, like in runners, it's like 50%, so again, we just have to be in the right place and
Sure.
in the right population.
Can Astym be used for other muscular
So it's
aches?
It's a common technique for a lot of musculoskeletal injuries. So basically, most places there's a tendon or ligament, it can be used. And I also read one article about how Astym can affect, how Astym can stimulate improvement in neurological conditions, because it can stimulate your body awareness. Sorry, I'm so sorry.
No, please keep
Talking.
Yeah.
So I've seen it used in a number of different cases. Even like personally, when I tore things in my shoulder, it was used on my shoulder to help the repair process.
Have you compared with the natural oils like eucalyptus and
I have not.
or any other like the Astym? Have you done any comparisons?
So, to my understanding,
It's a commercial product. right?
yeah,
Astym.
Bengay and BioFreeze are more for paint. Is that true?
Pain.
Yeah, I mean,
Really,
it's,
compared to-
those products stimulate the receptors in the skin, so what that's gonna do is work the gate theory of pain, so they're effective in that regards. So we could use that as a lubricant surface and get kind of a dual result from that. So it could be used, but as far as actually, stimulating growth factor within the tendon, it's probably not gonna, those local or those skin stimulants aren't gonna probably do much, so.
So what made you pick Astym? Are you mental?
Yeah, because I'm Astym certified, and I didn't really think the technique did anything. And I thought, I'm doing this, but I don't really know what's happening. So then I started a bunch of research on this, and then I joined with the company too. Contacted the companies that I want to do this, and they were supportive.
Conflict of interest? No?
What's that?
No conflict of interest?
They gave us no money or anything, so it was just.
Oh,
So that very, very